So remember last time we talked about the TPO, and that was our treatment plan overview. Today we're going to talk about your treatment plan, and what that is the TPO on steroids extended and elaborated out, just so that we have everything marked step by step. Okay, so when looking in your mouth, we saw some inflammation, some reddening, and some swollen gums from just the biofilm, or the sugar bugs, as you will, just all over the teeth. And your gums really don't like that at all. They don't like all that we call them the biofilm or the plaque on the teeth. And so the gingiva just starts to bleed and get bigger, and that's what's creating these pockets that are around your teeth whenever we are poking around the teeth. Yours range from 1 to 8 millimeters, and so that just shows some growth of the or some enlargement of that gingiva. Also, whenever we were looking, we saw some calculus, or some tartar, as you will, that was on your lower teeth and just around some of your other teeth, like above the gums, so on the teeth or under the gums, which would be supra or subgingival calculus. And that is the sugar bugs just hardened and like grew together. It's more like a sugar bug city, as you will. So we had those all over in the mouth, more localized to down here on your front ones, on your front teeth. And so also, whenever we were looking at everything else in the mouth and asking you all those questions about what you ate, did you exercise, about your family, we generated some risk assessments. So how high of a possibility you could get this and get that. And whenever looking at that, we show that you have a high risk of caries, so cavities, as you will, so like the brown spots in those teeth. And also periodontitis, you have a high risk for that. And the periodontitis is the like the bone disease in the mouth, so it just it takes away that bone, and we don't want any of that to happen. So because of showing that you have the high risk of periodontitis, the high risk of caries, and looking at the inflammation and the pocketing in the mouth, we've generated a plan that is personalized to you, and that is just for you and nobody else. Okay, so from looking at the last appointment, we determined that it's going to be 2 more appointments. So this appointment and another one, so a total of 3 in total. Okay, so here, if we look at the last appointment, we looked over your medical history. We did your x-rays. We also looked at your TPO. Remember, we painted your teeth pink, and we saw that there was a lot of pink on those teeth, and that's the BCR, the biofilm control record, and that's measuring the sugar bugs that are on your teeth. And we saw that you had a 75%, which you're like, yeah, 75 or almost close to 100, but we're wanting the opposite, actually. We're wanting it as close to 10 or lower as we can. So what we're going to do today is we're going to split your mouth up into a left side and a right side, and we're going to scale or clean half the mouth. So today we're going to focus on the right side, if that's okay with you. And what we're going to do is we're going to do that whole side. We're going to scale. So remember last time we showed you the scaling on your fingernail to feel what it would feel like. So it's nothing too painful, nothing scary about it. We're just going to go around each tooth with my instruments, and we are also going to use an instrument called a machine called the Cavitron. And what it is, it's an electric machine that spits out water and vibrates really fast, and it does have a high sound, a high-pitched sound. And I do know that because of your epilepsy, we know that some of the triggers are those monotonous sounds. But we do have some noise-canceling earphones for you that should help you out, and so you won't hear anything, okay? Yeah, so we're going to use that as well, and we're going to go around each tooth and make sure they're good and clean and free of those sugar bugs, okay? And we're going to remove those sugar bug cities, as you will, that calculus, and remove those off. And then that's what we're going to do today. And then next appointment, we're going to bring you back, and we're going to do your left side, okay? And then we're going to do the same things, give you the noise canceling earphones for the Cavitron. We're going to scale around all of those teeth, remove all of the sugar bugs from the whole mouth, and then what we're going to do is we're going to floss your mouth, and we're going to floss all of your teeth. And remember, we talked about that last appointment. I'm going to do it for you, and we're going to floss in between all of those spaces in between the mouth, and then we're also going to use my fancy toothbrush. Okay, and my fancy toothbrush has a special toothpaste to go on it that can remove all of that pink stuff from the mouth, and so it removes all of that biofilm and make sure that we have a clean slate so that you can start using those principles that I taught you last appointment, and then in this appointment and the next appointment, from the brushing, the flossing, from eating the right foods and not eating the right foods, and so you can have a clean slate to start doing that and just keeping your teeth in just tip-top shape. And then another thing to help you with that is we're going to give you some varnish, some fluoride, and what that is this gel that I paint on your teeth that gives strength to your teeth, so it strengthens them, makes them bodybuilders, protects them from those cavities, those caries. Okay. And then I'm going to give you a 6-month recall to bring you back here to come see me in 6 months. Okay. Does all of that make sense? Do you understand everything?
Yep, everything makes sense.
Okay, awesome. So I'm going to go ahead and get you to sign this and then date it.
Okay.
And so today is January 1st, 2017. Okay. And then we're going to continue your treatment and go ahead and start with the scaling of that right side today.
Thank you so much.
Awesome.